Under the Speaker's announced policy of January 3rd, 2025, the gentlewoman from Virginia, Ms. McClellan, is recognized for 60 minutes as the designee of the Minority Leader.
Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include any extraneous material on the subject of this special order.
Without objection.
Mr. Speaker, it is with great honor that I rise today to anchor this Congressional Black Caucus Special Order Hour. Sometimes, the voices of people and businesses impacted by congressional action or inaction get lost in the back and forth of the floor and the media. For months, members of the Congressional Black Caucus have focused on amplifying the stories of our constituents, and tonight we do the same, amplifying the stories of people, whether they're small business owners, their employees, the self-employed, farmers, or others, who could find themselves unable to afford health care without an extension of the enhanced premium tax credits. We know that there is a health care crisis looming in this country. We know that every American is one illness or accident away from economic devastation. That's the point of health insurance, to make sure that when they need care, they can access it without going bankrupt. And while the healthcare system isn't perfect, the point of the Affordable Care Act was to ensure more people had access to insurance through Medicaid expansion, through employer-provided health care, and through the Affordable Care Act exchanges, called Marketplace Virginia in my state. The more people have insurance, the more we know when they need care, they can get it and not go bankrupt. More importantly, they could get primary care, preventative care, so that when they get sick, because they will, they don't show up in the hospital when it's too late or more expensive to treat. And that when more people show up in those hospitals uninsured, they will get care, and the cost of that care goes to everybody else. Tonight, you will hear stories of people who purchase their insurance through the Affordable Care Act exchange, who, because of the enhanced premium tax credits, can actually afford their premiums. Without those tax credits, many of them, we have heard time and time again, will be forced to choose, do I buy that health care plan or do I feed my family? Do I pay for that health care plan or do I pay my mortgage or my rent? Do I buy that health care plan or do I pay my utility bills? Because for too many Americans, the cost of everything is too high. And unfortunately, many are being forced to forego health insurance and gamble and hope that they won't get sick. But they will, and we will all pay the price for it. It is my pleasure to yield to the gentlewoman from Alabama, Ms. Terry Sewell.
I want to thank my colleague for yielding. Just like the rest of America, we in Alabama are facing a health crisis caused by the Republican Party. Thanks to President Trump and Republicans in Congress, more than 58,000 of my constituents in Alabama's 7th Congressional District will see their health insurance premiums skyrocket next year. One of my constituents, a 63-year-old gentleman from Wilcox County, Alabama, in the rural part of my district, this gentleman works for the Wilcox County Water and Sewer District. Just like his coworkers, he receives health insurance through the Affordable Care Act Marketplace. Currently, his premiums cost $188.29 per month. But after receiving his rate letter last month, he learned that his monthly premium would increase by 700% to more than $1,500. That's right. Thanks to President Trump and Republicans in Congress, this gentleman will need to pay $1,300 more per month to keep the same health care plan. Mr. Speaker, this is simply outrageous. The people that I represent cannot afford these ridiculous Republican price hikes. Throughout the government shutdown and well before, Democrats have been sounding the alarm. We have been demanding that Republicans work with us to lower the cost of health care and address the crisis that they have caused. What did they do instead? They shut down the government and held food assistance hostage from the most vulnerable Americans. Make no mistake, the consequence of inaction will be dire. Continue down this road, millions of Americans will be forced to go without health care insurance, one unexpected ER visit away from bankruptcy. Those who cannot pay with their wallets will pay with their lives. Mr. Speaker, there is still time to act. We must extend the health care tax credits, and we must do so now. I want to thank my colleagues of the Congressional Black Caucus for this special order hour where we can tell the stories of our constituents. This gentleman in Wilcox County, Alabama, $188 today, will have to pay $1,500 next year. It's simply unacceptable, and we must do something about it. I am grateful to my colleagues of the Congressional Black Caucus for always standing up for the most vulnerable in our community. And I want to thank this gentleman from Wilcox County for sharing his rate letter, for showing us that, in fact, 700% increase is simply unacceptable, outrageous. He will have to choose between affording health care insurance or simply affording his rent. It's unacceptable, and we in the Congressional Black Caucus, we in the Democratic Caucus, will continue to fight for the Affordable Care Act tax credits to be extended. Thank you, and I yield back the balance of my time.
Thank you, Mr. Speaker. I now yield to the gentlewoman from Ohio, Representative Shontel Brown.
Thank you, Congresswoman, for leading tonight's special order hour. Thank you to my colleagues in the CBC for standing up for this fight. The fight to protect health care is another reminder of why I am so proud to be part of the Congressional Black Caucus. Because the members I serve with are truly the conscience of the Congress. And since January 20th, 2025, we have not given 1 inch to this cruel, callous, chaotic, and corrupt White House. Because the truth is, the communities we represent, including my hometown of Cleveland, cannot afford Trump's agenda. Working people cannot afford Trump's agenda, and Black America cannot afford Trump's agenda. There's an expression, when America catches a cold, Black America gets the flu. I would argue it's more like COVID before the vaccine. We can't afford the tariffs. We can't afford the bailouts. We can't afford the tax giveaways to the Mar-a-Lago guest lists. And we can't afford the largest cuts to Medicaid and to the Affordable Care Act in this nation's history. So let's be clear about what's happening, because we are living through a reverse Robin Hood story in America, and it hasn't always been this way. Because of the work of President Obama, President Biden, and Democrats in Congress, the Black uninsured rate fell to historic lows last year. That's right. We went from 20% of Black Americans being uninsured to just 10%. But it's not just Black Americans or people living in cities who have benefited, no. In fact, some of the whitest and most rural parts of America rely on the Affordable Care Act the most, including a lot of farmers in my state of Ohio. Because there were a lot of gaps in the old systems. There were a lot of holes in the safety net. And if Trump has his way, there's going to be a lot more holes in the net and a lot more people without health care. Millions more, to be exact. 38,000 people in my district are facing huge health care cost increases because of Trump's ACA cuts. The average cost increase is $700 per person per year. A lot of families will have to pay thousands more. Their voice should be heard, and we are uplifting their voices. Here's what Talia from Cleveland shared with my office. I quote, "I logged into healthcare.gov to renew my plan for next year, and my monthly premium multiplied by a factor of 4. It is currently set to be 4 times as much for health insurance as it was this year. I didn't go ahead and enroll yet because I'm hoping Congress gets their heads in the game and do what is right. I'm not making any more money this year than I did last year. My income is the same. Rent is going to increase, gas is increasing, groceries are increasing, utility bills are increasing, and now my health care too. It's becoming impossible to survive in this country," end quote. Talia, I completely agree with you. To my colleagues across the aisle, I implore you, stop protecting the powerful, stop serving the wealthy, and start listening to the people. Truly, it is time for Congress to get their heads in the game. I want to thank you, Talia, for sharing your story, and I want to assure you we will not give up on this fight. It's time we work together to cancel the cuts, lower the costs, and protect health care for all Americans. And with that, I yield back.
Thank you, Mr. Speaker. And now I yield to our chairwoman, the representative from New York, Ms. Yvette Clarke.
Mr. Speaker, I thank the gentlelady from Virginia for anchoring us in the Congressional Black Caucus's Special Order Hour, Stories from Home, the human cost of expiring health care tax credits. Tonight, you've already heard from my colleagues, and we speak for everyday Americans, families, seniors, young adults, and workers who now face the devastating reality that their health care premiums are about to double, in some cases, triple and quadruple, when critical tax credits expire at year's end. In New York's 9th Congressional District, this crisis is not theoretical. It's happening to the single mother in Flatbush, Brooklyn, who finally been able to afford her son's asthma medication. It's happening to the retired home health aide in Brownsville, stretching every dollar just to stay covered. It's happening to the young entrepreneur in Crown Heights who took a chance on starting a business because these credits made health insurance reachable and reliable. For years, these tax credits extended during the pandemic have been a stabilizing force for families across Brooklyn, New York. They helped protect our community, kept our small businesses afloat, and ensured that our neighbors could see a doctor without sacrificing their rent payments, groceries, or the life-saving medications that many rely on. But because of a prolonged and entirely avoidable Trump Republican government shutdown And because Republicans refuse to negotiate, the expiration of these credits will hit working families the hardest. In a city where the cost of living is already sky high, premium spikes will push many in New York's 9th District to the brink of losing coverage altogether. House Democrats stood united for more than 40 days to prevent this outcome. We fought to shield families from exactly this kind of financial ruin and healthcare shock. But once again, our Republican colleagues across the aisle chose politics over people. And Brooklyn, New York, like districts across the nation, will feel that pain most acutely. So tonight, the Congressional Black Caucus has done what it has always done. We center the people. We will bring forward the stories from home, stories from New York 9th District and every district represented by the CBC. We make sure that this chamber hears their names, sees and feels their struggle, and understands the real-world consequences of inaction. Because this is not just a policy. This is about whether families in Brooklyn, New York can afford their medications, whether seniors can age with dignity, whether our healthcare infrastructure can withstand the shock of hundreds of thousands, if not millions, using the emergency room as primary care, whether our children can grow up healthy and secure. The CBC is leading the fight for the extension of these critical tax credits and for the health and well-being, the humanity of every person we represent. And I hope that these stories this evening drive it home. With that, I yield back.
Mr. Speaker, may I inquire how much time is remaining?
The gentlelady has 43 minutes remaining.
Thank you, Mr. Speaker. Speaker Johnson has called the Affordable Care Act enhanced premium tax credits a boondoggle. But let me tell you what those tax credits have meant for millions of Americans. Over 80% of the tax credit goes to help working people in states that President Trump won. Since they were introduced, more than half of the growth in national enrollment has come from Texas, Florida, Georgia, and North Carolina. And who are these folks? They're not the 29-year-old sitting in his mother's basement playing video games. They're restaurateurs, beauticians, landscapers, mediators, chiropractors, funeral directors, farmers, ranchers, freelancers, contractors, gig workers. And now they're stuck. As open enrollment began and they opened their mail, they found that their premiums in some cases doubled, in some cases tripled. I heard from a local restaurateur in my district, Lester Johnson. He and his wife own Mama J's, a beloved restaurant in the Jackson Ward neighborhood of Richmond, which was once known as the Harlem of the South. The Johnsons rely on Obamacare or the Affordable Care Act for themselves and their 8-year-old daughter. They pay $700 a month, and Lester has estimated that if the subsidies expire, his bill will go up to $1,400 a month. He has about 40 employees, and they would see premium hikes as well. And Lester says, it's a lot of money for people. I think everyone is feeling the anxiety. He's worried about his family and the families of those 40 employees. I heard from Braun Hansborough, the owner of Flower Guy Braun, a Richmond small business. We've been looking at this coming down the pike for a few months, and I've had to be proactive, and I've had to consider what it looks like for my business if these credits are removed. And what it looks like is taking an increased risk and finding money that doesn't exist to make sure that we can supplement and offset the cost of my sole employee's expenses. His sole employee is Ronnie Moss, who said, "I found fulfillment in my part-time work as a floral and event designer with Braun. In 2021, I left my corporate job for a full-time employment. It was an important move for me to work in a dream career while contributing to the success of this small business. At reasonable rates, I've purchased health insurance on the marketplace, and the benefits that they've offered at my corporate job, while they allowed me to give birth to my handsome son, it's the marketplace that has proved more valuable to me. And now the increased insurance, on top of the increase in groceries and other living expenses, I'm not sure how my family is going to manage it." We've heard from farmers across the district who are already struggling, particularly soy farmers. And in my district in Virginia, we have some of the largest number of soy farmers in the Commonwealth. They're already struggling under the tariffs, that as a result of they can't sell their crop. One of my farmers said to me, basically, unless you're a beef cattle farmer, you're already a volunteer right now. And now we have to figure out not only how we feed our families, but how we pay for our health insurance, because we purchase under the marketplace. Why is it so important that people are insured? I was in the Virginia legislature when we expanded Medicaid under the Affordable Care Act. And the reason we did it was because we had rural hospitals that were about to close. We had so many people who were not getting preventative care, and it was leading an already bad maternal health crisis to get worse. It was leading an already bad infant mortality crisis to get worse. It was leading a preterm birth crisis to get worse. But by getting people connected to a medical home, paid for by insurance, in that case Medicaid, or later when we created a state-based exchange through the exchange, they could get preventative screenings that could identify cancer while it was still treatable. Pregnant women would be healthy when they got pregnant and not have to deal with hypertension and other chronic diseases that lead to a high maternal mortality rate. We saw health outcomes improve. We saw hospitals that were on the verge of closing because of the high number of insured overcome that risk. During the summer recess, I visited a dental clinic in far southwest Virginia, in Abingdon. Before that dental clinic opened, communities in southwest Virginia waited a full year for a dental clinic as part of a larger healthcare clinic to come where they could get basic dental care, dentures, and other types of dental care. When this clinic opened, 80% of their patients are Medicaid recipients, 20% are uninsured. Now, thanks to the pending Medicaid cuts, they don't know what they're going to do. They're worried about the uninsured in that community who are covered by Medicaid. And now that community is also worried about those that are insured through the Affordable Care Act. Because without your health insurance, you don't know what you're going to do when in the blink of an eye, your child is injured. I know that fear. When my son was about 3 years old, in the blink of an eye, he burned his hand. I happened to be in a rural area as part of a conference. We went to the local hospital. They didn't have a burn clinic, and they said, you can drive back to Richmond. This was on a Saturday. They said, you can drive back to Richmond, and on Wednesday, there's a a burn clinic. And they can take your son, or we can see if we can get you admitted to UVA Hospital or VCU Hospital, both of which were hours away. But we can see if he can get admitted right now. I said, we're going to see if he can get admitted right now. Between the ambulance ride, a week in the hospital, and the treatment, because I had employer-provided health care, I still had to pay $1,000 out of pocket. The total bill was $15,000. This was 12 years ago. Think about what that bill would be today. But I was fortunate because I had employer-provided health insurance. I only had to pay $1,000. But I think about how many people don't have that. And Medicaid or the Affordable Care Act is their only option. Right now, they're worried about whether that option is going to be available. And so what does that mean for the people that I represent? In Virginia, about 350,000 people benefit from the premium tax credits, enhanced premium tax credits. For a family of 4 that earns just under $130,000 a year, they will see their premium go up 43% to $4,675. For a family of 4 who earns $64,000 a year, their premium will go up 20%, $2,571 more that they have to pay for insurance. For a 60-year-old couple earning $82,000 a year, they'll see their premium go up 174%. Their premium will go up $11,968. Most of the families I talk to don't know where they're going to find that money. They don't know if they're going to be able to pay that premium. They do know one thing. Guaranteed they're going to need health care. They don't know if they're going to be able to pay for it. We will continue to raise these stories because too many people are depending on Congress to act. Their lives literally depend on it. And hopefully, before December 31st, we will find the political will to extend these tax credits. If we don't, we better come up with a solution to ensure that Americans all across this country can access the care they need when they need it. If we don't, how are we going to look them in the eye and say we served their needs? I worry about that. I worry about that mother who wakes up one morning bleeding, 9 weeks away from her due date, who goes to the hospital and isn't sure how she's going to pay, if she makes it, that bill. I worry about that mother whose child has to stay in a NICU for 6 weeks, who doesn't know how she's going to pay that bill. I worry about that mother who has to figure out, how am I going to get my child the developmental care that she needs to ensure she meets her milestones? Because all that costs money that she probably doesn't have. And that mother could have been me. But I was fortunate that I had insurance. And while I worried about whether my daughter or I would make it, I didn't have to worry about how I would pay for it. There are too many Americans who go to bed at night wondering, is that lingering cough something that I need to go to a doctor for today? Can I afford it? Or do I wait until I can't breathe and I'm in the emergency room? That's what's at stake. It's not a game about will Democrats or Republicans win. It's a question about whether the American people can get the care they need when they need it. And the Congressional Black Caucus will stand up every single day and fight, not just for our constituents, but for every single American, whether you live in an urban core, a rural holler, a suburban cul-de-sac, no matter where you were born, although we know, let me clarify, that if you're not a citizen, you're not eligible for the ACA. Let's just put that to bed for a minute. But no matter where you were born, where you live, the color of your skin, how you worship, you can get the care you need when you need it and know you won't go bankrupt. That's all people are asking for right now. And we're going to fight to make sure every single American can go to bed at night not having to worry about the answer to that question. So I thank you for your attention tonight. I ask you to come together to find a solution to this crisis. And with that, I yield back.